So let's talk a little bit about the webinar topics. First, an introduction. We will speak about why the United States is such a sought-after destination for surrogacy. We'll speak about being an international intended parent, going through some of the general kind of questions we get, speaking to agencies, travel, communication, and also the kind of relationship you build with your surrogate. So the surrogacy journey, step by step, we'll walk through that as well. Financing and costs and benefits of working with hatch, egg donation, and surrogacy. And we'll have some time for a Q&A, even though we are miserably behind schedule. Once again, so sorry. All right, a little bit about me. My name is Edwin Fogelmark. I am the international manager here at Hatch, Egg Donation and Surrogacy, and our in-house IVF clinic. So I am myself a father through surrogacy. I've done this journey as a Swedish intended parent. My daughter on the picture was born in 2020. So a little bit about me. I'll try to share my personal experiences as well as we go through the presentation. Okay, a little bit about Hatch. So these are the two companies, with same company doing two very different things. So on one side, we have Hatch, egg donation and surrogacy, doing everything non-medical. So finding your egg donor, finding your surrogate, doing all the legal work, which is the parental establishment and returning back with your baby. Also all of the insurance, which is a huge thing in the United States, and all the coordination that comes with this kind of big journey that needs a lot of different pieces of the puzzle to kind of work out. On the other side, we have our own in-house IVF clinic, Pacific Fertility Center, in your embryos, nurses and doctors, and all the screening and testing. Okay, so let's speak a little bit about pursuing surrogacy in the United States. So why do people come to the United States for surrogacy? First of all, it's been done for decades. The United States is the most experienced country when it comes to pursuing a surrogacy journey. So that comes with its own sense of safety and, legal requirements, and also that it's been done from a legal perspective. So another thing that's super important is that screening of egg donors and surrogates is the most extensive in the world. So that is a lot of way when it comes to how successful your journey will be from beginning to end. So the screening of egg donors and surrogates is the most extensive in the world, and that is a known fact. So that is something that also brings people to the United States. And that's actually, personally speaking, what brought me to the United States as well for my surrogacy journey. So surrogates are socially, mentally, financially stable, three super important factors for being able, to carry you through the journey itself. But also the standard of medical care is very high. So we're talking about hospital, delivery, all of those processes that you, your surrogate, and the baby will kind of be involved in. Also, speaking about the legal aspect, you will be the sole legal and physical parent of your child, or if you're several people, you together, will be the sole legal and physical parents of that child. So the process of parental establishment will make it safe for you to travel home with your child. You will have a US birth certificate, and your child will be an American citizen holding a US passport. So that allows you to return home. All right. So a little bit about being an international intended parent then. There are three kind of factors or most common questions concerning this kind of field that I first want to mention before going into all of the details and specifics. So except for legal, which is, a whole area of itself, how you speak to agencies and what you should consider, travel, how long should you be in the States, and communication are three of the most common questions that we get around, international intended parents pursuing surrogacy. So let's talk about the agencies first. So your agency should be experienced. That might seem like, a given fact, but the thing is that new and inexperienced agencies enter this market all the time. So it is quite an unregulated market. So they can enter the market at any time. It could be a previous surrogate using her friend as a surrogate. So that's good to keep in mind. So every agency has their own standards and protocols, especially when it comes to recruiting and screening egg donors and surrogates. And recruitment and screening of egg donors and surrogates is no easy deal. So it takes a lot of time to both recruit, but also screen and test and disqualify those who for some reason, medical, financial, or mental, are not fit to pursue surrogacy as a candidate. So experience matters, from these two perspectives. So what would be the first step? Obviously, a virtual consultation is the first step, or attending an event that an agency kind of holds. So we do events around, Europe, the world all the time. We were in London and Dublin not long ago, also in Copenhagen in Denmark. So next we're going to Germany in 2 weeks' time. So one of those events is also kind of a good way to meet the agency and see the representatives. But usually it's a virtual consultation first. So with that said, while you search for an agency, you will come in contact with many alternatives. So you have to find what suits you best because there are many agencies out there. So usually what that means is balancing between safety and cost efficiency. That's what's always in the focus, at the decision-making step of deciding for an agency, but also through the surrogacy itself, to be honest, decision-making and just balancing between being safe and cost efficient and cost conscious, pretty much. So another thing to consider is that some agencies handle every part of the journey. So others only have certain things in-house. For example, they might not have their own, egg donors. So they have to partner with an egg donor agency. Or even other agencies only coordinate the services themselves. They don't have any own surrogates or any own egg donors. So they only do the coordination part. So that's just to understand, when you speak to different agencies, to ask them, what do you have in-house? What do you do? And what can you do, pretty much? All right, so travel. So first of all, the entire process of surrogacy is done in the United States. So the egg donors are there, the surrogates are there, the IVF work will be done there, the legal work will be done there as well. So the entire process is in the United States. So when it comes to travel, we usually get the question, how many times do I need to travel to the United States? So you need to travel to the United States to create your embryos if you are using your own eggs, or if you're leaving blood and semen deposits. So when you create your own embryos and you're using your own eggs, you need to come to the clinic to do that. One very usual question is, can I ship my own eggs? Or can I ship my own embryos? If the intention was to use a surrogate at the creation of the embryos or eggs, you cannot ship them to the United States. That is FDA regulation, so we cannot control that. With that said, you come to the clinic, you do the egg retrieval there, and you're good to go. Blood and semen deposit is something that we need to do for the sperm source. So actually, with our in-house IVF clinic, we can now offer blood and sperm to be tested and shipped through one of our international partner clinics. So we have several partner clinics around the world. You can go there, do blood and semen work. You would have to pay for that and the shipping for yourself, but you can definitely do that if your time-wise is kind of, restricted pretty much. So that's something we've been able to do. During COVID, it was very appreciated, of course. So the second time would be to meet your surrogate or to be there for any of the ultrasounds. So this is pretty much optional. So obviously, we always encourage you to come to the United States to meet your surrogate, be there for the transfer or for the 20-week ultrasound. But, given the distance for international intended parents, we know that that's not always possible. So with that said, we do think that it's a nice thing, but it's not required. So it's optional. So when it comes to, let me just pull this up here. Okay, you're good. So when it comes to travel, except for those two, you also have to come, of course, for the birth of your child. So 2 to 4 weeks before the delivery of the child, you need to be in the United States to prepare for the delivery. So that is obviously not an optional visit. And then also there could be additional clinic requirements, depending on what work you will do, there could be additional requirements for you coming. So pretty much we're saying, blood semen work, using your own eggs, come to the clinic. That's one time. The second time is to wait for the delivery of your child. Okay, relationship and communication. That's another thing we always get asked to know. How do you build a relationship with a surrogate living in such different places, different continents? So we always encourage to communicate closely with the surrogate, and we are there for you during that process. We are there to facilitate communications. If there are issues in the communications, something breaks down in the relationship, we are there with you to mend that and move you forward to a better place. So with that said, a close communication with the surrogate will build a relationship that usually, lasts until the journey is done or even after the journey. So the thing is with surrogates, they love hearing your joy through the journey. When you care about the surrogate, it means that you're supporting your child, and they love hearing about, your support. So for me, I had very close communications with my surrogate, spoke to her via WhatsApp or whatever means we had 2 to 3 times a week. We FaceTime, sending pictures from different hikes we did or whatever activity you like to do. So that's kind of the relationship that we had during the pregnancy. But it could look very different depending on what you're looking for. So we match the right surrogate with the right intended parent based on a lot of different preferences, including communication and relationship building. So what do you want? What kind of communication do you want? And what kind of intensity do you want from that? So one thing to kind of send on a personal note is that your initial standpoint on the relationship might change. So my initial standpoint, as an example, was, I would love to speak to her during the pregnancy, love to know more. But after that, I would love, for there to be less communication and to be some separation. But as we went through the journey, we built a very nice relationship with the surrogate. So in the end, we ended up being in communication with her still. She's visiting us in 2 weeks. We're going to a wedding in Mexico next year. You don't have to do all of these things, but what I want to say is that the initial standpoint might change as you go through the journey, as you build that relationship. And communication between continents does work. You just have to find out what works best for you: video chatting, texting, sending photos, and all of that. So before the pregnancy, we usually say once a week at least to check in, to start to build that relationship. During pregnancy, we like to see that being stepped up a little bit, 1 to 2 times a week. And after the pregnancy, it's still important, but it can look very different. I told you about my experience. Yours can be very different, just sending a photo every now and then, or whatever you want to do. But, it's still important to keep that communication relationship afterwards, to not feel that, you just left the relationship after the delivery of the child. But really the key to positive communication is to match with the surrogate who wants the same kind of communication as you. Right, let's move on given the late start. Okay, so let's talk a little bit about the timeline. So this is the timeline for surrogacy, a general timeline that we usually share. So depending on, your surrogacy needs, your egg donor needs, using your own eggs or not, and the clinical needs, it will look a little bit different, but this is the general timeline. Starting off at month first with, you sign up on the match list, we start to search for a surrogate for you. You start your donor search. So you start to search for that donor if you need one, and you do the clinic sign up. So that's pretty much what happens, the first step in this journey. Then you search for your egg donor if you are in need of an egg donor and you have a donor match. So this can shift a little bit depending on your requirements, when you find that egg donor in the database. We do a donor screening. So at Hatch, this is a second screening on the egg donors. We pre-screened all of them with our in-house IVF clinic. So this is a second screening that we do just to make sure that everything still looks good. We do some legal work, medications, and prepare for the donor retrieval. If you're using your own eggs, that would be your egg donor retrieval. We create the embryos. We do something called PGT testing. So PGT testing is the genetic testing for a lot of different various genetic diseases and chromosomal variations. So we freeze the embryos after that stage, and we have a matching time of 8 months currently. So you have a surrogate match, you have a surrogate screen. Once again, all of our surrogate candidates have been pre-screened in our clinic. And you do legal work, medications, and you have an embryo transfer. After that, you have 9 months of pregnancy. People usually ask me, well, not usually, but sometimes ask me, can it go quicker? It can't. We have to wait for that time. After that time, you have the parental establishment process in the United States, the birth certificate and passport, and then you return home to your home country. So a very quick overview, but this is a good general timeline for you to consider when you kind of go into this journey and when to start. And please feel free to ask questions in the Q&A. I'll get to them as soon as we are finished, if you have anything along the way. So let's speak about the process step by step. So the first step you would do is initial consultation. That's what I talked a little bit about before. So that is about 1.5 to 2 hours where you speak to an agency going through your specific situation based on what you know already and what research you've done. That can look very different, also depending on what needs you have. So after that consultation, if you are comfortable moving forward, you are signed on and you meet the team at Hatch. So that can look a little bit differently depending on who's on that team, but you have your team allocated and they will follow you through the journey from beginning to the end. So if you're not working with our in-house IVF clinic, it's time to choose your clinic. Usually we have intended parents waiting, a little bit later until you choose your clinic, but I really do want to recommend you to choose a clinic as soon as possible. You don't have to wait until you're matched or, until a very late stage. If you can, and you're up for it, choose a clinic in a timely manner so you can start some of the tests and screens that need to be done. So if you're working with our clinic already, our in-house clinic, that's already been taken care of. So then you have a donor match if you need that, or you do your embryo creation, egg retrieval if you're using your own eggs. We have the surrogate matching process after that. It's legal work, matching you with the right surrogate based on your preferences, based on her preferences. That's a very hands-on kind of way to match. And for you wondering, more about that, I will go through some of these more in depth after this slide, so you know more about the matching and legal process, for example. But you have the matching process. We match you with the perfect surrogate. We have some legal agreements that we need to put in place, legal work. We do the embryo transfer after that at the clinic. So you can be there for that if you want to. Some intended parents are, international ones, not so much, especially now with no COVID restrictions, even though they are much, much more opened up at this point. So after that, we have the confirmation of the pregnancy. You travel for delivery 3 to 4 weeks before. And then we establish the parental rights, which I will also speak more about in a minute. And then you're traveling home with your bundle of joy. So this is pretty much what you're looking at, on a step-by-step basis throughout the whole surrogacy journey. All right. So don't worry about your questions. I'll get to them at the end. I can see that they have been asked here. So a little bit more in depth about the surrogate matching process, which is obviously super important to match you with the right person. So we will be advising you throughout the whole matching process. And that's the thing with working with an agency. That's one of the biggest responsibilities of an agency amongst many, to match you with the right surrogate, so you don't have to do that work by yourself. So we don't let you look at a lot of different options and profiles. We handpick the right surrogate for you based on your preferences, which we've spoken into depth with you and also with our surrogate candidates to understand who is the right match. You, of course, will have opinions on who that person is. We do review the profile with you in detail before the match, but we don't have a database for you to look through. Because the recipe for a successful match is to match with someone that fits you emotionally as well as legally. So we only work in states where, with surrogates in states where surrogacy is lawful and permitted, so surrogacy-friendly states. And like I said, intended parents cannot see several profiles at once, but neither can the surrogates. So you do get the chance to have an opinion, so does the surrogate, but we don't give you a lot of different profiles. So this is what I talked about before. We review the surrogate's profile with you in detail before the match, including essential areas such as insurance and state regulations, which has, applicability for the legal process afterwards. So we do that before, so you know what you're getting with your surrogate candidates. And some of these things are super important, such as insurance. That will affect a lot of your journey and cost. So we really want you to understand the insurance situation before going into that with the surrogate. So we would review all of that with you before. Also guide you through insurance considerations, of course, which is super important. And also all surrogates, like I said, are medically pre-screened by our in-house IVF clinic. All right, so let's talk a little bit about surrogate screening. It's kind of weird that it comes after surrogate matching, but the thing with surrogate matching is that's what everybody asks you about, right? So that's what the international intended parents usually ask me about. What is the matching time? How quick can it go, and how do I actually match? So something that we find is super important at Hatch, and which every serious professional ethical agency should do, is surrogate screening. So just to give you a little bit of background about the Hatch surrogate screening. So the first, it sets off with the Hatch surrogate application. Then we do an initial screening call, speaking to the surrogacy candidate about, a lot of aspects of her life, her situation, her wish to become a surrogate, where that stems from, what her kind of picture of surrogacy is. Then we have a medical questionnaire. We collect records directly from medical providers. So we get them to our agency and we review those records with the assistance of our in-house IVF clinic. Actually, our chief medical officer reviews all of the surrogacy candidates' records and pre-approves them as surrogacy candidates. So then they have a social screening call. So that is a call going more about, the emotional, the mental kind of aspect of surrogacy, but also about the support system that the surrogate has in place for her journey, because she usually has a partner or a husband that's her support system, or friends and family. So we really want to know that that is in place and that she has that support at home. Then there is a medical process call, going more into depth about the medical questionnaire, the records, but also keeping the surrogate up to date about what's going to happen, at her surrogacy journey when it comes to medications, appointments, or what she's expected to do from a medical point of view. Then we have a partner interview call. So this is super important. A call with her partner, talking about the surrogacy journey, the feelings he or she might have about, her partner or his partner doing surrogacy. This person is crucial to this journey. Usually that's something that's overlooked a little bit, but, having gone through this myself, the partner will play, a big part in supporting the surrogate. He or she doesn't have to be, all, pom-poms and jumping around about the surrogacy journey itself, because in some sense, he or she is cut off from it. But still, she needs that support, the surrogate. So it's super important that the partner is on board and supports her and, supports you. And then we do routine background checks on everybody involved. And then there's a third-party psychological screening with a a health medical professional to do the psychological assessment. So just to focus on that a little bit, the surrogate screening, we know people want to match quickly, but it's also about, matching correctly. So that's really what we try to focus on. Okay, so legal and parental establishment. So one of the most crucial elements to this journey, of course, our partner attorneys are leading in surrogacy law, many of whom we have worked with for decades. So they also partner with country-specific attorney partners to, understand the home country's specific requirements and take that into consideration during the parental establishment process. So this process can be quite different and vary depending on how the state looks. So what are the kind of rules in the state? So you have pre-birth order states, you have post-birth order states. You have a state that is kind of a mix between pre-birth and post-birth order. And then you have some states where they require you to do a second parent adoption. And there are states that are kind of like a combination of all of these things. So the thing to know that with the pre-birth order state, we can have all the documents in order in place and submit them to the court. Actually, nothing can happen until the delivery of the child anyways, but we can still prepare that documentation and hand it into the court. That's the difference between a pre-birth and post-birth order state, that in post-birth order states, we can't hand that in until the birth of the child. We do still prepare all those documentations, and the legal team will work with you to do that. So it's not like we're sitting idle, but we just can't submit that. So when it comes to returning back to your country, some countries require the parentage to be established in the home country, as well as in the United States, while other countries do not. But either way, returning home is not an issue since you can obtain, an American passport for your child. Your child is an American citizen with a US birth certificate. So the returning back with your baby is not the issue, irregardless of, how this process looks, if it's a pre or post-birth order state or a combination of those. The thing to know is that the home country can have specific rules. So, for example, in my home country, it was a quite smooth process because they did respect and kind of uphold the parental establishment in the US. So it was more kind of like a technical issue here. But other countries, need that parentage to be established in the home country as well. But you would work with the attorneys to, figure that out and work with the local attorneys to know what has to be done in your home country when returning back home. And a good thing to know, when you return back home, we are still there with you, providing the documentation that you need, doing that work as well, and helping you out with that. So it's not a goodbye at, you returning home to your home country with your child. Okay, so traveling home with your bundle of joy is an extremely special time. So your team attorney will work to obtain the necessary legal documentation, the court orders, the birth certificate, and the passport so that you can return back home. And like I said, Hatch will be with you throughout the process. You can always reach out to us and reach us if need be. So after delivery of the child, you will usually have a checkup at a local hospital at about 1 week old. So the great thing with COVID, one of the few great things, right? Because COVID has been horrible and still kind of puts, some things into perspective for us. But when it comes to the court sessions for parental establishment, that can often be done via Zoom. So Zoom hearings actually. So even in the Zoom courtrooms, COVID has kind of, spread its kind of effects. So you can usually be there via Zoom, which is quite, smooth for you. You don't have to go there with your child, but it all depends on, the state where you live and the county where that court is. And then flying home with the newborn, a lot of people ask, about, how that goes. Actually, flying home with the newborn can be done quite early. So if there have been no complications at delivery or any other underlying issues, you can fly home quite quickly with the child. That's not why you stay longer in the States. It's just to finish the court order work, the birth certificate, and the passport. So that's actually what is kind of, the wait after delivery, not that you have to wait for the child to be prepared, even though it's nice to have it be, a little bit older, so to speak. So for me, for example, we stayed in the United States for 3 weeks and maybe a day or two. That's how long it took, to finish the paperwork, to acquire that passport, and then return back home. So we were there 1 month before the birth, hanging out with surrogate, her family, and 3 weeks after the birth. But that could look very different, but you should be prepared to stay, up to a month at least, so you're ready if something, takes a little bit longer. And also flying with the newborn, we did that with a 3 weeks old. They're super calm usually. They sleep, they eat. That's not the big issue. Now, when our daughter is 1.5, almost 2 years old, now the issues really hit. So now, you have to make her entertained, keep her not from running around, disturbing other people. So, you can feel quite calm with the newborn. You feed them, they sleep, and that's, pretty much it. Okay, financing and cost. So when it comes to financing and cost, our Peace of Mind program is a fixed free offering that includes all common costs and contingencies with baked-in discounts. So it covers all costs, agency and clinic, and it minimizes the risk of unexpected expenses, including, essential pieces of the journey. So that way you can focus on what is important, the journey, that's where your focus should be, the child that is to come, and not, all these unexpected costs that pop up. So let me just walk you through the options. So the egg donation, surrogacy, and IVF option is that you use egg donation, surrogacy, and IVF with us. That is a $199,000 pricing, and it includes essential areas beyond these, but these are some of the kind of crucial ones. So it includes the surrogate compensation, all the legal fee work, the insurance for the surrogate, unlimited transfers to live birth, all clinical costs, and also rematching if you for some reason should have a match break or another situation which requires a rematch. So the same goes for this over here. So surrogacy and IVF, $176,000. This package is for those who find their egg donor somewhere else and brings them to our clinic and work with us for IVF, creation of embryos, and surrogacy. So you can bring your own donor to our clinic. That's totally fine. You can also use your own eggs in that package, but it is subject to some qualification when using your eggs, and the doctor would speak to you about that and assess that qualification. But in that case, it's $176,000, and it still includes all of these fixed fee costs for essential parts of the journey, such as insurance and surrogate compensation. So for this here, surrogacy, $129,000 does not include IVF costs. So at a certain age, we have to, we can't bear the risks of the unlimited transfers. Then we find the right package for you. So we find the right IVF package with our in-house clinic, and you add that package cost onto the $129,000. And the embryos have to be created at our in-house clinic. With that said, the surrogacy program here still covers these essential pieces. The only thing it doesn't cover is the unlimited transfers and all the clinic costs, because we find the right package for you with our doctor and we put that in place for you. And also surrogacy, using another clinic is also an option, of course. Surrogacy only using another clinic, we are estimating that to $130,000 to $150,000. And that is a non-fixed fee for that journey. So these are the program options. I hope that it's somewhat clear. You can always, reach out and ask us questions afterwards, of course, about these options. But the Peace of Mind program is really built to cover essential parts of the journey and give you, exactly that peace of mind that whatever happens through the journey, you do not have additional costs and surprising costs coming up. Okay, so let's speak a little bit about why you should work with Hatch. So first of all, we have 30 years of experience in the field. So this was the first egg donor database in the United States and one of the first surrogacy agencies. We have a 99.5% success rate. So what that means is that 99.5% of those who sign on have a baby at the end of the program. So very few don't have a baby or for some reason exit the program. So we worked in over 52 countries all over the world, which is of course important for knowing local laws and regulation and understanding the situation in your home country and communicating and coordinating with you from that home country. We worked with 1,000 donors and surrogates since our inception, 3,300 happy, healthy births and counting. We have top candidates with physician oversight. So what that means is that we utilize our in-house clinic and the doctors very early on in the testing and screening of all egg donors and surrogates. So we have our own in-house IVF clinic, so covering all of your agency and clinical needs, including medications and PGT testing for the Peace of Mind programs. And also, we are very much a personal, individualistic agency, but with the capability and knowledge and resource of a large agency. So, we are very personal in the sense that when you sign up with us and communicate with us, you will hear from, our CEO, the agency president, everybody reaches out to you, welcomes you to the programs. We are a very personal program in that sense. And I just love that about the agency. So almost 70% of our team have personal experience of egg donation, surrogacy, and IVF. And that's personal experience. Obviously, we all have business connections to this. We're all working at the agency, but 70% of us have personal experience, which I think is great because at this stage, it might be a lot of, logistical factors, financial costs that are in focus. But later down the line, it's also about the personal and emotional journey. Having gone through that myself, I really appreciate the support you get from someone who knows what you're going through. And I just think that's a big plus. So decades of experience regarding insurance, legal considerations. Like I said, we can handle the whole journey from start to finish in one place. Everybody knows who you are, agency and clinic. That's one of the perks of doing the Peace of Mind program. When you go to the agency, everybody knows who you are. When you go to the clinic, the same thing there. So you will have your personal team following you throughout the journey from signing up to returning home and beyond that as well. But also with our agency and clinic, you can kind of pick and choose, depending on your needs. So the Peace of Mind program is a great offering, doing everything in one place. Other options is, do egg donation with us if that's only what you need, or use us for surrogacy and or the clinic, or you can do everything in one place, like I said. So we are flexible. You can bring your own donor, you can work with your preferred lawyers, choose whatever service you need, decide on which package works best for you. This is your journey, and that's how we view it. So you should be able to make these decisions for you. And we have offices and representatives in both the US and Europe. I'm obviously the Europe representative, so you're more than welcome to speak and reach out to me, of course. Okay, so like I said, please, you're very, very welcome to meet with us, to book a complimentary consultation with us. That's a dedicated time just for you to walk through all of your questions and concerns, including specific needs. So you can schedule that consultation by sending an email to edwin@hatch.us, then you will reach me. And you can also scan the QR code below, which will kind of reflect my booking calendar for you. So you can look in ease when it suits you to have a consultation. You can also save it down to your browser actually, so you can return to it at a later time. Obviously, you can follow our social media here to the right. And the point of that is not, the following. The point of that is the Hatch Babies and PFC sites, social media sites, have great information and resources for you regarding IVF, egg donation, surrogacy, and all of those things. And like I said, hatch.us/events, you can go in there as well. You can see what events we have going on. We have upcoming webinars that will hopefully not be as messy as this one in the beginning. Once again, I'm sorry about that. But we do have upcoming ones about, surrogacy stories, surrogates sharing their experiences and other kind of topics. Also there, you can see where we are coming to physically. For example, Germany is the next country we are visiting. Any German, IPs here, we would love to meet you there. You can check it out on hatch.us/events. Okay, so I really want to get into your questions here. So let's go. Okay, so how come your matching time is much lesser than other agencies? A lot of other full service agencies state 12 to 14 months of matching time. A good question. So there could be a lot of different reasons. Obviously, I'm not really, I don't know why other agencies have that time frame. So we are a mid to big sized agency that could come into place. So the huge agencies, they do hundreds and hundreds of journeys a year. Obviously, they have a long waiting list. So in that sense, we are a mid to large agency. So we have maybe a little bit of shorter of a waiting list. So the matching time right now is 8 months at Hatch. Depending on your preferences, that can shift back and forth, a little bit, but that is what you should expect for the matching time, about 8 months. So we really focus a lot on the screening part. So we have 5% of egg donor candidates and surrogacy candidates becoming surrogates or egg donors with us. So for sure, which you say is the much lesser matching time, I'm happy to hear it, but for sure it's not about cutting corners at screening and testing. So it's hard to answer with not knowing what's going on with other agencies, but that is the matching time at Hatch at this point. Can you share the presentation? Yes, for sure. I will share actually a recording of this webinar so you can actually see it afterwards. So we do not have any representative in Southeast Asia, but we do have team members that can speak languages from South Asia, for example, Mandarin. We do have that in the clinic. Also on the agency side, we have some Mandarin proficiency. We do not have a lot of different proficiency in the Southeast Asian languages, unfortunately enough. We don't have a representative there, but we do sometimes go to different places, like I mentioned, even beyond Europe. So, for example, Australia. We were in China once before the COVID, but now it's really hard. Other countries we haven't visited physically, but please feel free, depending on what language and representative you're looking for, feel free to reach out, and we'll see if we can, handle any language needs you need. When it comes to, having representatives, we don't, but we worked with intended parents in over 52 countries, including a lot of them in Southeast Asia. So we're not inexperienced in that sense, but we just don't have a representative in place at this point. So baby health insurance, which we recommend, is something that you would work with your insurance coordinator and your insurance agent to find the right insurance fit. It also depends on where you are at. So for example, for Southeast Asian intended parents, there are options that are not maybe reasonable for others. So you would work with our insurance coordinator and agent to find the right one. So I do have to we have to wait to that stage to be able to do that. We have actually recently started to look into working with Surro plans. They offer some solutions when it comes to newborn insurance. So please have a look at their website. Okay, let's see. No more questions at this point. Please feel free to just ask any question that you have. The newborn insurance, just to kind of on a note, is a super important thing. Delivery costs and the cost if there would be any complications in the United States can be very high for that care. So international intended parents really need to put that into place for their newborn. But with that said, for the newborn insurance, we will still work with you, with our insurance coordinator and an external insurance agent to find the right coverage. We just can't include that for international intended parents and put that into place. But we will work with you to find the right coverage, and you will be a part of that, finding the exact right plan that you need. Oh, sorry. Here is one question. If you don't know any attorney or not. Okay, so if you don't know any attorney or law firm in the US, will we be able to help you out? Yes, of course. We have a long list of amazing attorneys that we worked with, some of them for decades. We refer you to them and we work together with you and them together for the legal process. So we don't send you away, to find that representative by yourself. It's only that if you would want to work with somebody specific, you can, and we would reimburse you for that work in the Peace of Mind program. But we definitely have great attorneys that we do recommend that you work with, and we are there with you for that process as well. Right, let's see if there are any more questions. So just on a note, that's exactly what I did, for my journey, having, an attorney refer to me, working with that attorney to do all the legal establishment, the parental establishment. My surrogate was in Minnesota, so I did all of the legal work there. I've left this up behind. I don't know. I hope that you can still see the presentation. I'm very nervous with the technical issues, right? So I hope you can see it. Please feel free, to scan whatever you need to. If you want to follow us on social media or you want to book a consultation, I'll just hang back and see if there's any more questions. So do you have any example of problems when crossing abroad? So I'm guessing your meaning is, crossing back from the United States back to your home country. So no, we don't see any issues with that. That was a big kind of issue when in the midst of COVID, right? So both coming to the United States and sometimes, being able to leave the United States. But no, we don't see any issues with that now. With that said, the COVID is very much a kind of changing situation. We don't see any indications of a close down or anything like that. So for this moment right now, we don't see any problems of crossing abroad. Since you have an American passport, you have that for your child, the US birth certificate, you are able to return back. All right, let's see if there's any more questions. So please feel free, if you need to leave. So sorry once again for the delay in the beginning, but feel free to just leave. I want to thank you so much if you do. If you want to stay back and ask questions, please do that as well. I'll stay and answer more. Let's see if I can make this bigger. So what costs are not covered? So the costs that are not covered are, one, your own travel costs. So your costs to travel to the United States, for the testing and also for the delivery of your child are not included. Also, the newborn insurance is not included. So that's between $8,000 to $10,000, somewhere around $10,000 for putting that into place. So except for those two things, the travel and the newborn insurance, all other costs are included in the Peace of Mind program. But that will be subject, to exactly what program you have. So we will speak about that, when your certain needs at a consultation. Okay, so what kind of medical issues would disqualify surrogates? So surrogates can be disqualified, for example, of a range of different requirements from BMI range to previous pregnancies, a number of C-sections, number of pregnancies, how delivery has gone, preeclampsia, high blood pressure. There's a lot of different things that can disqualify a surrogate from a medical point of view. We do the pre-screening on them exactly for that reason, and also at match. So that will be tested for. So those are some of the situations that would kind of disqualify them as a surrogate. For intended parents, there isn't much on the medical side that would disqualify you. For the sperm source, you need to be able to produce some sperm. That's a given. But pretty much there's not much other that would disqualify you as an intended parent for medical reasons. But that's also something you would be able to ask at a private consultation, and we can go more into depth about that. Let me see here. I just realized that I have to scroll up and down. It's not like coming in on orders. So, okay. So can multiple embryos be implanted, for example, if there is a desire to have twins? So the short answer is yes. The long answer is that you can do that, but we will walk you through all of the risks that are associated with the double embryo transfers and with twins. And those are risks for, the surrogate carrying twins, for the babies themselves that will most likely be born premature, and also for you, intended parents, from a financial point of view. The insurance will be more expensive and you will pay more to the surrogate for carrying twins. So while we can do that, we do go through that into depth with you about the risks. If you still want to do that, that is a possibility. We just want you to be very aware of the risks that are involved with double embryo transfers and with twin pregnancies. So when the baby is delivered, born, how long does it take to fly in an appropriate, suitable time? So I'm guessing, if you're asking me for the baby's kind of capability to fly, a baby is fine to fly within 1 to 2 weeks, but that kind of, depends on how the delivery has went, have there been any issues and all of that. So when it comes to waiting 3 to 4 weeks, it's more about finishing the legal process and the parental establishment. So that's what takes time. So that's what makes you wait in the United States for 3 to 4 weeks. Okay, so in the future, will you have a session like this again for intended international parents? Yes, I'm sure that we will. Probably, we'll revisit the issue. Sometimes we have plans of doing, specific webinars for specific countries. So that's something you can look out for as well. I do recommend, keep an eye out on hatch.us/events. We might be coming to your country, then you can come and visit us. We would love to meet you, but also you can see if there is anything specific to you that you are more interested in. Surrogates, egg donors, being a gay intended parent, all of these webinars, we will be running them at a monthly basis. And I'm sure that we will revisit intended parents, international ones, at one stage. Let's see here if there's anything else. Okay, so far I've seen that I've answered all of the questions. So please feel free for another minute to jump in with last minute questions. If you need to go, thank you so much for joining us for this webinar. I'll say it a third time. I'm so sorry about the beginning. Thank you for being patient. You were great in being patient, and now having been able to learn what we need to change for the next time. So I appreciate you being my trial bunnies, and I'm so sorry for that. So please feel free. I'll give you a couple of minutes to ask some last questions if you want to. If you don't have any, thank you so much for joining in. I'll hang back and see if there's anything else. Nothing so far. All right. I'll just hang back until I see that you have dropped off or asked the question. I don't want to leave anybody hanging in the room by themselves and with unanswered questions. So I'll just hang back for a bit. If you need to go, you can do that. The recording will be sent. Let's see, we have another question here. So sorry that you have to see the presentation. I don't dare to move anything right now. I'll just move this forward one step here. Okay, so let's see. Thank you. Thank you so much. Thank you. Appreciate it. Let's see if there's anything else. If I missed anything, I'll go through that here. Thank you. So sweet of you. Thank you. Enjoyed speaking to you. Please feel free to ask any last wish. Okay, if you could not find the best egg donor, so what should we do? So that depends a little bit on what you mean of the best egg donor. So we have the largest egg donor database in the United States. So we have, around 280 plus options at this point. So if you wouldn't find the best egg donor with Hatch, you can find an egg donor in another database. You can bring them to Hatch and work with us for the Peace of Mind program. As long as you create embryos with our clinic and use us for surrogacy, you're more than welcome to bring in an egg donor that you found somewhere else. That is the $176,000 option for the Peace of Mind program. And you have the same guarantees, the same safety as other Peace of Mind programs. You just bring in that donor because we want you to have the right donor for you, right? Not the right donor for us. So some agencies will say that you have to work with their egg donors, and some clinics will require you to choose their own egg donors. But we think that's, that's not the right way to do it. We want you to have the right choice for you. So if you don't find that at Hatch, please bring them into Hatch and do the Peace of Mind journey. You're more than welcome to do that as well to get the right fit for you. All right, I'll just hang back for another minute. Let's see if there's anything else. If you have to leave, thank you so much. Still see that there's some of you left here. I'll just hang back. If you're leaving, thank you so much for joining us. After delivery, where the baby stay before takeoff. So the baby is with you all the time. So the baby is with you from delivery until you go back home. So the baby will be with you in the space that you have set up for you for waiting for the baby and for having the baby afterwards. So pretty much that means that depending on if you're living in a hotel, an Airbnb, whatever kind of option you have, you will be staying there with the baby. So for example, for me, the baby was with us in the, we were in the delivery room. We had a room afterwards with our baby. We stayed in that room. The surrogate was in another room. After 2 days, we were released and we went back to our Airbnb, which we rented, and we stayed there until we returned home. All right, let's see if there's anything else. Perfect. All right, seems that we've answered all of the questions you've had. Once again, feel free to scan the QR code, save it on your browser so you can return and book a consultation with us, or just email me at edwin@hatch.us with your name, last name, and your email will follow, of course. Please, if you do email, give me some additional information about you for the booking. I'll also send you a booking link. So either do that or just scan the QR code. So, all right. So I think that we'll say goodbye for now. Thank you again for joining. Excuse me once again from the beginning. So thank you so much. I hope that this has been a good webinar for you. And please look out at hatch.us/events for anything else that we're doing. All right. Thank you so much for joining.